So if you have a clinical diagnosis of PTSD, that gives you an average of 15 years on the glycan clock. So menopause gives you an average of 10. Well, chronic stress state gives you 15. We've done another study that's just coming out now on medical residents in their first year of residence, medical doctors. And there you have the lack of sleep, very poor diet, but most of all, very high levels of stress because lives are at risk and you've never done this job before. So we've done the psychological questionnaires with 100 residents and measured their glycans. And with the scores on anxiety, depression, and stress had the biggest correlation with your results. And in some cases, this is not a published paper, so I don't want to say something wrong, but I think the average acceleration will be above the 15 years and sometimes even 20 in that period of time, which is all, of course, mainly attributed to stress. And that's something that's hard to measure and hard to intervene because you have two choices. You can remove the stressor or you can get better at stress. And getting better at the stress is very hard to do. But maybe I'll give you a case study where that was very easily fixed because, you can only accumulate so much stress. But there was this executive that worked with one of the functional medicine practices. And every few months they do a case review with us and they show us some interesting case studies in practice. And there was this lady who had a high-level executive job, very stressful by nature, and 2 young kids. And then she did HIIT training every evening. And her glycan clock was 15 years above what it should have been. And then her doctor was like, okay, well, we can't take away the kids. We can't change your job right now. Let's change HIIT to yoga because that's physical stress, but you're putting it on top of psychological stress and a very demanding schedule. And she changed the HIIT to yoga. And within less than 3 months, her age dropped 13 years. So she got much closer to her age. So if you can identify what is the stress factor in that person or what is the one thing you can change that's high impact, that can basically remedy majority of the damage.